डॉक्टर मेहरा को देखना है। So good morning to you all. Thank you for joining in for this session today. Today Dr. Aparna will be talking about sudden cardiac arrest. Dr. Aparna is Director Cardiologist and Electrophysiologist at Fortis Escorts Heart Institute, Okhla. Today she is here to take your questions about sudden cardiac arrest. Please put your questions in the comment section and we will try our level best to answer all your queries. So with this I would like to give this platform to Dr. Aparna to answer all your queries.
Good morning to all of you, and I hope we will make it worthy for all of you in the next couple of minutes. We chose this topic and there could have been no better opportune time to be discussing this simply because of what happened last week, all of us aware, to Shane Warne. In fact, that very day we lost two cricketers of great fame, and the world of cricket was completely devastated, especially with the demise of Shane Warne, who was 52 years of age. And this is what we want, that we all should understand and take it forward from there. So I think, as the name implies, sudden cardiac arrest is very simple. It's a cardiac arrest which happens suddenly. To put it in simple terms, if anyone who is going to get it, he knows it's going to come, he would not be home. He would be in a hospital setting or he would be in some clinic. So certainly this is something which comes suddenly, it is out of the blue, and it is devastating and consumes a life. And the unfortunate part is it consumes a large number of lives in their productive years. So it's important we understand and know what is it that we can do to safeguard ourselves from this entity in times to come, so that some living life around us is saved by having learned about the nuances of sudden cardiac arrest. It is extremely complex and heterogeneous. I will try and keep it as simple as we can.
Right, ma'am. Thanks for explaining about sudden cardiac arrest. So just to start with, I would like to ask, what are the causes of sudden cardiac arrest?
So if we were to elucidate the causes of sudden cardiac arrest, the most common cause of sudden cardiac arrest is having a blockage in the blood vessels of the heart. It's even more intriguing if you were to know that over 50% of people who had sudden cardiac arrest were not aware that they had blockages in the blood vessels of the heart, meaning thereby we must look after ourselves very well when we are young so that we do not develop the blockages in the blood vessels of our hearts. There are some other causes which are less common, like somebody may have a disease in the valve of the heart. Somebody may have what we call a thickening of the heart muscle called hypertrophic cardiomyopathy. Some people may have a dilatation of the heart, what is called dilated cardiomyopathy. And there are some diseases which run in families we call inherited channelopathies. But to keep it very simple, the commonest cause of sudden cardiac arrest is a disease in the blood vessels of the heart.
Right, ma'am. So next question I would like to ask you is, what are the signs and symptoms of sudden cardiac arrest? How would someone get to know that they are under risk of sudden cardiac arrest?
Yeah. So is there any sign and symptom of sudden cardiac arrest? Well, the first and foremost is that if you think that you have risk factors for heart disease, means if you are a diabetic, you have high cholesterol, you have high blood pressure and you smoke, or you have a family history of disease in the blood vessel, that is coronary artery disease, it is time for you to go and get tested if you have any disease in the blood vessels of your heart. That is one. Second, if you have any symptoms such as chest discomfort when you walk, or chest discomfort when you climb a flight of stairs, which comes in the center of your chest, it feels as if somebody has tied a knot or a band across your chest, you must seek medical advice from your local cardiologist. Third, if you have any symptoms such as dizziness or have had a fainting spell, it's important that you connect with your doctor to understand if you could be at risk of any such element happening in the future.
Right. Ma'am, how common is the sudden cardiac arrest?
So it will be fascinating for you to learn but rather depressing, I should say, if you were to know the real numbers. It is 1 per 1,000 per year globally that succumb to sudden cardiac arrest, which becomes a very large number. In certain geographies wherein the heart disease is more common, like India, it is actually lesser than 1 per 1,000. Means even more people, 1 per 500 also, could succumb in their adult years after 35 to 40 years of age to sudden cardiac arrest. It is that common.
Ma'am, is there any age group for sudden cardiac arrest, or it does happen to only elderly people?
Sudden cardiac arrest, as I told you, is complex and heterogeneous. It is not that it happens only to elderly. It happens to people who are anywhere beyond 35 years of age. It can even happen to younger people than 30. However, if we were to talk of the majority of the people consumed by sudden cardiac arrest is beyond 35 years of age, up to 1 in 500 to 1,000 can succumb in their living lives. Elderly people also succumb to sudden cardiac arrest, but the majority happens in a younger age group.
Right, ma'am. Ma'am, as you're talking about younger people, so what causes sudden cardiac arrest in younger people?
So what causes sudden cardiac arrest in younger people? That's a very important thing to learn. So what happens that when we are young, in our growing years, we develop blockages in our blood vessels. When we are very young, we develop a thickening of our blood vessels. That thickening of our blood vessels, the small blockages which happen in our blood vessels continue to remain there, and if we are not prudent about exercise, our diet, about our blood pressure, those blockages continue to increase. At some time in our lives, which can happen even in young adulthood, that blockage bursts. When that blockage bursts, it causes a sudden heart attack, and during that heart attack, we can have sudden cardiac arrest. Also, we have to understand that younger people can succumb to sudden cardiac arrest by a problem which runs in their families. Like I told you, some people have thickening of the heart muscle. Some people have a genetic problem. But you should not think of uncommon causes. We must always focus on the common causes. The commonality is that we must safeguard each one of ourselves and our people in the family from developing blockages in the blood vessels of the heart.
Right, ma'am. Ma'am, as you are telling that sudden cardiac arrest is a life-threatening disease, so how can someone prevent this disease?
So how do we prevent any one of ourselves or our family members from sudden cardiac arrest? You will be surprised that the prevention of sudden cardiac arrest is very simple. When we are young and we are devoid of any illnesses, we must exercise well. We must eat healthy. We must safeguard ourselves from developing high blood pressure, developing diabetes. We must take care that our cholesterol stays fine. So we should not smoke. Alcohol consumption should be in small quantities. We must keep ourselves agile, must not remain sedentary. So if we were to do all of these, that means we do good risk factor protection of ourselves. For a good period of time, we will be able to ward off the blockages of the blood vessels. If you can safeguard yourselves from developing the blockages in your blood vessels of the heart, there is a good chance that your likelihood of having sudden cardiac arrest is diminished. That is one. Second, if you already have heart disease and supposing you have undergone an angioplasty or bypass surgery, it's a good idea that you must go back to your doctor routinely at least once every year with your blood tests, your echocardiogram, and your doctor and your cardiologist together will identify whether you are at any risk of sudden cardiac arrest. Your local cardiologist is good enough. If your heart pumping is normal and if you have no symptoms and you have been advised good list of medications, there is no need to worry that you are at risk of sudden cardiac arrest. Third, if you have had an angioplasty or a bypass surgery but have a poor pumping of your heart, if the pumping ability of your heart, what we call ejection fraction, is compromised, if the pumping ability of your heart is lesser than 35%, it is a good idea that you begin to speak with your doctor, with your cardiologist, to understand if you are at risk of sudden cardiac arrest, and if so, he may advise a treatment that is called a small device which is called an implantable cardioverter defibrillator.
Right, ma'am. So, ma'am, as you have told about ICD, I would like to ask more about ICD. What is an ICD?
So first we have to understand that we have to protect ourselves from the risk factors of developing disease in the blood vessels of the heart. By doing so, we protect ourselves from sudden cardiac arrest. Those of us who have family members or have heart disease, we must look after our risk factors very well to protect ourselves from sudden cardiac arrest. Those of our family members who have heart disease with a compromised pumping of the heart, means the pumping ability of the heart is lesser than 35%, you must talk to the doctor for the need of a device which is called implantable cardioverter defibrillator. This is what is called an implantable cardioverter defibrillator, and this is what it looks like. It is a small device which is like a matchbox. This device is implanted under the skin. Just like we have a pocket in our shirts, we make a little pocket under the collarbone and we insert this device. This device, with the help of one wire or a lead as we call it, is connected to the heart. We must remember that this device is called implantable cardioverter defibrillator. As the name implies, it's implantable, hence it's called implanted. It has a unique ability of cardioversion and defibrillation. If any of you wants to know, we can connect later, but it's a very intelligent device. It is as if a very intelligent doctor is in your chest wall. It is as if an emergency room doctor is walking with you everywhere. You feel very confident, because if you were to have an episode of sudden cardiac arrest because you had a risk for it, the implantable defibrillator, before anybody knows, diagnoses it and treats it. By giving you a therapy which you may not perceive, which is called anti-tachycardia pacing, or it may give a little shock therapy. We must not worry about that shock, because that shock is life-saving. That shock saves us from death. So this is what an implantable cardioverter defibrillator looks like. It is indeed a medical marvel. It is known to save lives.
Right, ma'am. Thank you for explaining very well about ICD. So you have just talked about cardioversion and defibrillator. Can you please highlight something about this?
Yeah, I think for the common public, all you need to know is, I'm sure when you watch movies, you see that somebody, when they are passing away, you see a big machine which is brought in the hospital setting, and we put 2 paddles in the chest wall and we give a shock therapy. So that's what we call the shock that is delivered from outside. So you are aware that in the hospitals you see those big defibrillators. Obviously nobody can have those big things in your homes. Who will give those shocks? All of that little big device is compacted into this little device, which is called a defibrillator, implantable. This has been around since 1985. We have been aggressively using them. We have been advocating them for those of our patients who deserve them. They are battery operated devices, and these devices last approximately 6 to 9 years depending upon the usage. They are battery operated devices, and these devices, once implanted, can be interrogated externally by visiting a pacemaker clinic, which is there in all major hospitals, and every 6 months we interrogate the devices. In fact, these devices are extremely intelligent. These devices have a unique ability today to remain connected with your doctor, and your doctor can get the information every morning when he wakes up if there is any abnormality that may have possibly happened in your heart, and without even you or your family member having to know, your doctor comes to know, and they further connect with you and let you know about it.
Right, ma'am. Ma'am, as you have just told about defibrillator, so I would like to ask, what is an automatic external defibrillator and who all can use that?
Yeah. So I think many of you will be traveling. Of course, in the last 2 years, all of us haven't traveled, but soon we will be. And when you are at any airports, now even Indian airports, international airports, You see at important places a small box which is hanging on the wall, and it is called automated external defibrillator, AED. So I told you this little device is an implantable defibrillator. We have today available in common areas which are public spaces where there are a lot of people trafficking. It is called automated external defibrillator. We have these installed so as to protect our fellow human beings from the occurrence of sudden cardiac death. If any of our people, our loved ones, or for that matter, these celebrity people, for instance, Shane Warne, or for instance, the president that we all love the most, APJ Abdul Kalam, had the ability to be offered an external defibrillator at that point in time, probably a life could have been saved. It is called automated because it works on voice commands. It's extremely intelligent. It does not need human interface. It learns itself that the patient is having an abnormal rhythm and delivers a therapy externally. So AEDs are something which we have significantly using today, and they are of great worth.
Right, ma'am. Ma'am, do AEDs always help in sudden cardiac arrest victims?
So AEDs are the first point that they could potentially be of use. We have to remember that you cannot install AEDs everywhere. They are expensive. However, automated external defibrillators, as the name implies, are automatic. They are external. They are hanging in public spaces. They are known to safeguard a life. So in all those places, in fact, all airports, railway stations, malls, movie theaters in the United States and in the Western world have these AEDs in several places so as to save a life where potentially could be consumed by sudden cardiac arrest. But we must understand that those of our patients who have understood that their heart pumping is compromised, they must go and seek advice from their doctor if they need the implantation of a device which is called ICD. It's a simple device. The implantation procedure is also simple. It's about for 45 minutes. The patient stays in the hospital for just 2 days, and we must understand that it is life-saving for those people who truly deserve it.
Thank you, ma'am, for explaining it so well. Like, is there anything that a bystander can do to help save a life threatened by a sudden cardiac arrest?
Yes. So today, a lot is happening on teaching basic life support. So I think there is something called cardiopulmonary resuscitation. We as cardiologists in India and globally are moving ahead, taking these classes into the classrooms of children, into the police stations, into malls, into public spaces, so that most people understand what is basic life support. We all must invest. At least one member of the family must attempt to learn cardiopulmonary resuscitation. As the name implies, cardiopulmonary resuscitation. By learning so, you could potentially save a life. It is very simple. It just takes a few minutes to learn it, and it's a good idea if you have some kind of a organized or a structured course where you can practice on a mannequin, because potentially you could save a life if you have learned cardiopulmonary resuscitation. The young of our country should be motivated to learn it in school or college so that we actually could save a life.
Right, ma'am. Ma'am, I would just like to ask, after resuscitation, will the survivor be able to resume a normal life?
Yes. So we have to understand that if we act well in time, we can save a life, a productive life, and the individual can be absolutely normal. We must also remember, beyond 8 minutes, the likelihood of survival of an individual is extremely poor. So we have to act quickly. The first few minutes of sudden cardiac arrest, where you see an individual dropping down, are the most vital. Do not waste them, but rather, if you have learned cardiopulmonary resuscitation, immediately do cardiopulmonary resuscitation, and if you do not know that, call for an ambulance immediately.
Right, ma'am. Ma'am, another question I would like to ask you is, what is the difference between sudden cardiac arrest and a heart attack?
A heart attack is a blockage of the blood vessels of the heart. Sudden cardiac arrest is a stoppage of the electrical circuits of the heart. So they're two different things. In very simple terms, when there is no water in your pump, in your sink, that's a heart attack. When there is no electricity in your house, that's sudden cardiac arrest. So that's the difference between the two. The treatment offered is also by two different specialities. That's interventional cardiologists and this is electrophysiologists. So that's what it is.
Right, ma'am. Ma'am, do survivors of sudden cardiac arrest experience any complications?
Survivors of sudden cardiac arrest can face complications if they have received therapy way too late. If the therapy has been received by them well in time, it's a life saved well.
Right, ma'am. Ma'am, we have one question for you in the comment section. Mr. Biswa is asking if home and handy 6-lead ECG will be helpful to avoid deaths.
I think that's a wonderful question, and for the rest of the audience, if I can show what he's talking about, this is the device. Thankfully, I have it handy with me here. This is what he's talking about. This is a device which is an ECG device. It can take a 6-lead ECG. I will strongly recommend that we must try, in one family, which is a large family, they must keep at least one of these devices, which is called a cardia. This device helps to send the rhythm. However, you should remember, this device cannot prevent sudden cardiac death. This device is only going to pick up an arrhythmia, a heart rhythm disorder, but it is not going to save a life. However, we must want to pick up arrhythmias, so this is a very handy device. That's a very good question.
Right, ma'am. Ma'am, there is Mr. Anil Hans in the comment section who is thanking you for being his savior. He might have got device implanted from you. And we have Mr. Vijay Sharma who has joined from California, USA to see your this program. So we would like to thank everyone here joining in the comment section and viewing this program. Thanks for joining this session.
Thank you so much for being here. Please post your questions. Jaya and me together will be able to answer them, and we shall not disappoint you with our next session. Thank you so much and a good day.